Talking about COVID numbers that are finally trending downwards. In particular, though, we're talking about Illinois. This is over a month after the state reported a staggering record 15,415 new daily cases. Let's bring in now the director of the Illinois Department of Public Health, Dr. Ngozi Ezike. Dr. Ezike, thank you so much for being here. And you tell me, what in the world is it that you all are getting right that your numbers are trending down?
Thanks, TJ, for having me. No, it's been such a collaborative effort. We have this phrase, all in Illinois, and it really has been just a collaboration of the people of Illinois doing what we've asked them to do, what the science has led us to recommend. The hospitals, the other state agencies, of course, the incredible leadership of our governor, J.B. Pritzker. We're all working together to get these numbers down, and it really is working, and it's exciting to see that.
I know you all were going through it and had some peaks, but it's been trending downwards. Now, you're telling me, and I assume you all might be hearing from other states and other health officials, other places, asking, what are you getting right? And you're now going back. You're telling me it's nothing complicated. You haven't put some new wonderful plan in place. You're simply following the guidelines, and your citizens are doing a good job of following the guidelines.
Well, yes. I mean, there are mitigations in place, and there have been intensified mitigations that have been in place for the last 5 weeks. But mitigations without people who adhere to them don't do anything. And so we often focus on the groups and the businesses that aren't complying, but there are so many more people. The majority of people are on board and making this happen.
What are your fears now? I think they're nationwide fears, but do you have fear that now after the holiday, I don't know what your numbers might be there about how many people in Illinois actually traveled and have been gathering for the holidays, but are you expecting the next 2-3 weeks maybe to be tough?
Absolutely. That's something that we're going to be looking very closely at. You know, Thanksgiving is a much shorter holiday. We had the most tiny blip, almost insignificant, but with the Christmas and the New Year's, with that break being days, weeks, actually, you know, there's a lot of concern, especially as the fatigue is real and people have maybe said, like, I did what I did at Thanksgiving so that I could have my Christmas. So we will have to follow that closely, but we're trying to make sure that people know no matter what choice you made, it's still going to be very important when you come back. If you know you've been out and gathering, you've got to get tested. You've got to find out quickly in case there was spread of infection so that we can isolate and quarantine those that need to be.
And you all, something else maybe to be proud of, and your governor was certainly touting this, that certainly you all aren't the most populous state, but you all were leading in the number of vaccines, COVID vaccines administered. This was at some point last week. Don't know what the updated numbers are, but at some point you all were leading with 100,000 plus doses of vaccine administered. How were you able to do that?
No, again, it's collaboration and teamwork with both the team at IDPH, our state partners, and our hospital partners, and of course, our boots on the ground, the local health departments. It really helped that we got this Pfizer vaccine. It has that logistical challenge with the ultra cold, but since we knew there was only 5 days, we had basically taken the lid off, we opened it up, and so the timer was on, and everyone understood that we had to get all of those doses in the arms. And so that's what everybody all in Illinois did together. And so excited that we had that #1 spot.
And also your hospitalizations, the periods, the average hospitalization there dropped from 9 to 11 days to 7 to 9 days for people in your state hospitalized with COVID. What's behind that?
Yeah, I think that we have enjoyed learning the collective learning with this COVID disease, right? This is not something that people learned in medical school, but we've had this on-the-job training. So understanding the benefits of proning, understanding the role of steroids, all the lessons learned from that first wave have been applied now. And I think people are seeing better outcomes and shorter hospital stays.
Well, I know you all aren't out of the woods, but we have been doing a lot of interviews with a lot of health officials around the country, and this is one of the first ones we've been able to do here on GMA3 where there was so much actually good news to report. I know you're not out of the woods, but there's some stuff going on there in Illinois that is worth celebrating. So Dr. Ezike, thank you for taking some time with us. We hope to continue to check in with you, and maybe the numbers keep getting better and better. But thank you so much, and congratulations on some of what you have been able to accomplish.
Thank you so much. Thanks, TJ. Happy New Year.
All right. Happy New Year to you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.